A chronic pain has to be addressed in a multifaceted fashion. So you have to use individual and different approach tailored to each individual patients. So you're not saying that, okay, well, there's a chronic pain patients or pain patients with a low back pain, and I'm not going to have a subscriptive prescribed approach to that. I need to evaluate the patient individually, look at the patient's the socioeconomic background, all the factors that come into play when you're evaluating the patient, that what treatment that will be suited for them. So when we do that comprehensive evaluation in our first visit, we try to determine the best approach that would help the patient. So there are two main approaches in the chronic pain. One is the medical management, in which you are actually trying to be a very conservative and giving them, prescribing them some pain medication, some muscle relaxants, some physical therapy type approach. And then that's the first step. And then the second step, which is second section of or branch of pain management that we do, which is to definitively identify the source of the pain. How do you do it? The source of pain has been identified through performing a precision X-ray guided spinal injection to identify their nerve pathway, their pain pathway, their source of pain. And that branch of pain, which we get extensively trained on, is called interventional pain. And that's what we incorporate most of the time. And the advantage of that treatment is basically you are not relying on just pain medications. You're not just relying on opioids or muscle relaxants, which can sometimes compromise the quality of life for the patient. So what we are trying to do is to incorporate the interventional approach, where once we have done the assessment and diagnosis, then we make a treatment plan for the patient, and then we identify what is the source of patient's pain and try to treat it in that direction more definitively.